Hi, my name is Linda Sutton. I am a patient navigator. Patient navigators help patients access and navigate the complicated healthcare system. We play a role in improving health conditions by removing barriers to care and addressing problems among vulnerable patients who will avoid contact with providers due to issues that may stem from distrust, communication problems, or poor health literacy. One of the many disease processes that affects a large part of the population is diabetes. An estimated 23.6 million people in the United States, or 7.8% of the population, have diabetes. Type 1 diabetes is an autoimmune disease. Since a person who has been diagnosed with this must take insulin daily to live, lifestyle changes are necessary. With symptoms of type 1 diabetes including increased thirst and urination, constant hunger, weight loss, blurred vision, and extreme fatigue, with the disease itself usually developing over a short period of time, daily activities can be affected. If not diagnosed and treated with insulin, a person with type 1 diabetes can lapse into a life-threatening diabetic coma, also known as ketoacidosis. This is a preventable consequence. Type 2 diabetes develops gradually. Its onset is not as sudden as in type 1 diabetes. Diabetic ketoacidosis is a serious complication of diabetes. If a patient has diabetes, they must learn the warning signs of diabetic ketoacidosis and know when to seek emergency care. Often, with diabetic burnout, a patient does not bother to check levels. Diabetic ketoacidosis signs and symptoms often develop quickly, sometimes within 24 hours. Some symptoms include excessive thirst, frequent urination, nausea and vomiting, abdominal pain, weakness or fatigue, shortness of breath, fruity scented breath, and confusion. Those that experience confusion may not know to seek medical help, and untreated diabetic ketoacidosis can be fatal. One of the problems associated with diabetes, and one that I believe needs attention, is diabetes burnout and the harmful behaviors that can stem from it. As I have stated, there are so many Americans being diagnosed daily. It is not limited to the older population. Some battle this disease from childhood, a long journey for many, prompting burnout. Managing diabetes and its lifelong commitment of tedious day-to-day management, such as regular blood sugar checking, insulin injections, dealing with spikes and drops in blood glucose levels, constant monitoring, and dietary adherence, along with physical activity to combat obesity, is time-consuming and requires drastic lifestyle changes. When dealing with this over a long period of time, and with the constant pressure of time management and monitoring, people will avoid their medication, disregard healthy eating, and adopt behaviors that will actually harm them in the long run. They may turn to alcohol or drugs to deal with the stress and anxiety. They risk diabetic coma by ignoring falling blood sugar levels. Complications from the self-destructive behavior can be serious, as I have noted. I propose to you that you give serious consideration to this and attempt to lessen the burden of burnout, particularly with those patients living alone who could be at higher risk for serious complications with no one there to assist them if an emergency situation should arise. As a provider, by providing resources and developing a system to pair patients with other diabetics in their community for one-on-one wellness interaction, someone they can turn to for support and encouragement could be the first step in integrating a program of friendship and disease management, providing help with medication and testing reminders, which can be phone calls or text messages, exchanging recipes and healthy eating ideas, exercise support, and social interaction to boost morale and stave off depression and anxiety. Patient navigators can help by assisting with community resources and working with the provider to enable the patient to have access to any and all available help. Creating this support system for diabetics can provide better health outcomes and lessen problems that stem from the burden of this disease. Monthly meetings with educators and patients, along with their chosen peer or buddy, can help monitor the progress of both patients, discuss options and new developments on treatment, offer suggestions and exchange of information and incentives for healthier outcomes to help patients enrolled in this program to have options for guidance in managing their disease and direction when they don't know where to turn. With the reckless and dangerous behavior that can be prompted by diabetic burnout, it is imperative that no one die alone. Thank you. My debriefing. Did I represent myself professionally and in the role of a patient navigator? I believe I did represent the ways that patient navigators can break down the barriers faced with this problem. Did I successfully make the case that a change is needed or possible? I believe I was successful with presenting the case and outlining the reasons why a change is needed. Did I sufficiently explain the cause of the problem? I do believe I did sufficiently explain what leads a patient to experience this kind of burnout. Did I discuss vital impact factors adequately? Each factor was addressed as to frequency, intensity, duration, and onset, and the impact this problem has on health outcomes. Was my solution practical, likely to be adopted, or adopted by the proposed stakeholder? I think I provided a solution utilizing healthcare professionals in an educational capacity to provide healthy solutions and socialization to promote improvement. What did I do best and what can I do better in the future? I felt I put my best effort into explaining the etiology of the problem and its subsequent impact on a population affected by this increasing disease process. I believe that in the future, a compilation of statistics showing affected populations could help, as well as cultural impacts and economic factors. Thank you.